So today we're really happy to have with us Dr. Alaa Al-Slaity, who's a postdoctoral fellow at the Pervasive Computing Lab and the Faculty of Computer Science at Dalhousie University in Canada. He received his PhD in computer science from the University of Ottawa, and his thesis was nominated for the Best PhD Thesis Award in 2021. Dr. Al-Slaity has published several peer-reviewed papers, two of which have received the Best Paper Award, and congratulations. His research interests include persuasive technology, personalization, user modeling, and human-computer interaction. And today he's going to talk to us about personalized, persuasive technologies for health. The one-size-fits-all is no more fits-all. So thanks very much for being with us.
Thank you for introducing me, and thank you again for this invitation. Hello, everyone. Thanks for coming. And today I will present on behalf of my Persuasive Computing Lab at Dalhousie University in Halifax, Canada. This presentation entitled Personalized Persuasive Technologies for Health, the one-size-fits-all no longer fits all. I hope that this will be interesting for most of you. It's a technology involved in health care and health and wellness. So the agenda for this presentation will start by introduction about persuasive technologies for healthcare. We'll talk about the problem and why we need personalization. Then we will talk about approaches of personalization, how to personalize. Finally, we will summarize our talk. So recently, healthcare applications have gained increased attention. This is because research shows that users find health apps as a good alternative for self-management of health conditions, especially in the last 2 years when access to physicians was limited because of the pandemic. Therefore, hundreds, if not thousands, of mobile apps for health have been proposed for either promoting healthy behavior or demotivating unhealthy behavior. Mobile health apps or mobile apps for healthcare are known as mHealth apps. Now, somebody may ask, can computers change what we think and do? Can they change our behavior? For example, can computers motivate you to stop smoking, persuade you to buy a diet program, or convince you to be involved in a regular physical activity? The answer is yes, they can. And in 2003, Dr. Fogg, who is a professor at Stanford University, has coined the domain of research, design, and applications of what's called persuasive computers or persuasive technology. Dr. Fogg reveals how websites, software applications, and mobile devices can be used to change people's attitude and behavior. So what is persuasive technology? Persuasive technology, according to Dr. Fogg, is the technology designed to change attitudes or behaviors of the users through persuasion and social influence, but not necessarily through coercion. So persuasive technology is used in various domains nowadays, including sales, politics, management, and for sure in health domain. It actually has the potential to be used in any area of our human-computer interaction. While persuasive technologies are found in many domains, considerable recent attention has focused on behavior change in health domain. So health domain was one of the main focuses of persuasive technologies, and it's actually one of our main focuses in our lab. Numerous scientific studies shows that mobile health behavior change interventions can influence users' behavior. And over the past decade, several persuasive interventions have been developed targeted at impacting one or more aspect of health and wellness. These technologies can broadly be classified into two main categories: persuasive technologies for health promotion and prevention, and persuasive technologies for disease management. Persuasive technologies for health promotion and prevention are targeted at behavior undertaken by individuals for the purpose of preventing illness detecting early illness symptoms, and maintaining general well-being. Examples of this category include being physically active, healthy eating, smoking cessation, and many more. The other category, which is persuasive technology for disease management, helps patients improve health-related self-management skills, such as teaching them how to manage certain illness and helping users comply and adhere to treatment directives. Now, researchers have found that the most effective intervention are modeled on health coaching, where users are asked to set goals, educated about the consequences of their behavior, then encouraged to track their progress toward their goals. This figure summarizes the reported results from the evaluation of the persuasive technology for health and wellness, reviewed in a paper published by the lead of our lab and her co-author. The results, as you see here in this figure, shows that 70% of the reviewed work reported fully positive outcomes from using the persuasive technology to impact specified health behavior, which means that they concluded that the persuasive technology used was useful to achieve the goal intended from that technology, while 17% of the papers reported that the results was partially positive, and only 8% reported negative or other. And we mean by other is that the results was not published. Okay, so as you see, the majority of the research and work in persuasive technology reported success of persuasive technologies for health purposes. But despite the significant work in using persuasive technologies for health and wellness, the existing research still suffers from various issues. Among these issues is what is known as the one-size-fits-all issue. Now, the available persuasive interventions treat all users similarly. However, we know that users are different. They are different in moods, personality, awareness level, for example, interest in changing behavior, and more. Even the same user may have different tastes and different preferences from one time to another. So my feelings in the morning may be different than my feelings in the evening, and my feelings today could be completely different than my feelings tomorrow, and so on. In addition to that, contextual factors affect users' responses to and perception of persuasive technologies. Contextual factors include time, weather, application area, domain, and much more factors. So research in this direction has demonstrated that using inappropriate strategies can constitute a major barrier to behavior change instead of a major motivation. So if we use the incorrect persuasive strategy, we may demotivate users. What's the solution in this case? In 2017, Orji et al. Have mentioned that persuasive interventions for health need to be tailored to various individual characteristics in order to increase their effectiveness. And one of our main research directions in the Persuasive Computing Lab is to handle the one-size-fits-all challenge through personalization. The idea of personalization is that instead of designing one solution for a wide spectrum of users who are to a high extent different, we design solutions that are adapted based on different factors, including demographics such as age, gender, for example, education, based on personality traits, gamer types, for example, stage of change, and many more other factors that can be used for personalization. Now, the question that may arise is how to personalize. How do we personalize persuasive technologies? There are several personalization approaches targeting different levels of personalization. So we have approaches and we have the levels of personalization. So let's first talk about personalization level, then we will talk about different approaches of personalization. We have two main personalization levels. The main level is the semi-personalized, which is on the group level. So we divide users into groups or clusters. These clusters have some common characteristics. For example, we say that people who live in this area can be assigned to this version of the persuasive intervention, while those people who live in another area are assigned to another version of the persuasive intervention. So we divide people based on shared characteristics within the group. This is the high level personalization, which is based on groups. The other level is on the individual level, which is fully personalized and more fine-grained personalization. In this level, each user has their own profile, or they have their own characteristics, and the system studies these characteristics, and based on that, the system provides the most suitable intervention based on each individual characteristics. So this level is more fine-grained than the group-based personalization. Now, these two levels of personalizations can be done in three different approaches. Personalization can be done in a static approach, in a dynamic approach, or finally in a hybrid approach, which is clearly combine both approaches in one solution. Now let's talk about each of these approaches and provide a use case for each approach based on part of our work in the lab. The first approach, static personalization. In this approach, we personalize at the design level. What does that mean? When we design the system, before the system is operated, we provide static rules to the system to follow when it needs to personalize something. So we identify a set of rules, and the system starts comparing the situation with the rules that it has, and based on that, it personalizes. So nothing is done in the runtime. And how does that work? We have users on one side, and we have persuasive techniques on the other side. And we need to match these two parties together. What we will do is we need to build user profile. And again, here we are talking about user's profile. This profile could be made for individual user, if we are talking about individual level of personalization, or it could be a group profile, if we are talking about group-based personalization. After we have user groups or users profile, we need to match these profiles with persuasive techniques. This matching process is done through different approaches. We can use statistical analysis, user studies, where we study how users interact with different persuasive strategies, and based on that, we identify or we draw mapping between users' profiles and different persuasive strategies. This is what we call user modeling. So we build a model about the user to know what this type of users prefer more, or what persuasive strategy is more appealing to this type of users. So this is user modeling. Also, we can rely on previous studies. If we have a study that is already done and they provide clear recommendations for designing static personalized system, then we can use that study. But an important point here is that, as we mentioned, the contextual factors are important in personalization. So if we are to use a previous study outcomes, we should make sure that this study is or has similar context to a high extent to our problem. So this is how static personalization is done, and this example is one of our rules, which we inferred in our studies, we found that school age users act too much with school related activities in the summer. So the recommendation is that during summer, mobile health apps targeting school age users should emphasize family and friend related activities. So here as you see, we identified the user profiles. We are talking about school age users. So the characteristics that we rely on here is user's age. So any user in this age, if the system finds any user of this age, then the system will apply this rule. This is an example to show how we provide static rules to the system. Now, as a use case, we designed persuasive game for disease prevention using static personalization. So as you know, in the previous 2 years, we all have been affected by the COVID-19 virus, and we noticed several rules and several safety measures set by governments. However, not all people adopted health safety measures, and there was contradictions information which make it difficult to some users or to some people to decide whether to follow these rules or not following these rules. So the idea was, as a contribution to this domain, is to design a game that aimed to change users' intention to adopt precautionary measures. So this work investigates the effectiveness of a persuasive game we called COVID Backman. It's designed to promote the adoption of precautionary measures tailored to user stage of change. So we used stage of change as a measure to distinguish users and to build users' profiles. So this game used persuasive technologies, but it also used these persuasive strategies or technologies in a personalized way. So as we mentioned before, to do static personalization, we need to identify persuasive strategies and users' profiles. In this work, we used 4 persuasive strategies, which are reward, suggestion, competition, and self-monitoring. And to distinguish users and build their profiles, we relied on the trans-theoretical model, or the TTM model. The TTM suggests that an individual readiness to adopt a healthy behavior progresses through 6 stages. These stages are also known as stages of change. The TTM also suggests that persuasive interventions can be tailored to motivate and adapt to individuals at different stages. As shown in this figure, there are 5 stages of change, which are pre-contemplation, contemplation, preparation, action, and maintenance. So an individual at the pre-contemplation stage is not following any precautionary measures against COVID, such as using hand sanitizer, face mask, and hand gloves. And these individuals have not considered starting any of these activities within the next couple of months. In the next stage, a contemplator is not following any precautionary measures, but is considering starting these activities in the next couple of months. Then a person at the preparation stage has decided to follow precautionary measures against COVID and has taken some initial steps to achieve their goals. After that, when the person is in the action stage, these people have already started practicing all the precautionary measures against COVID in the last couple of months. Finally, a person at the maintenance stage is following all the precautionary measures against COVID for more than 6 months. And these stages, based on previous research, can be divided into 2 main categories: early stages of change and later stages of change. So the first three stages are considered as the early stages of change, while the second two are considered the later stages of change. The main difference between these two categories is that the first three stages, which are the early stages, are more about thinking and exploring the behavior rather than taking an action. The actual action and the direct action is started to be taken at the fourth stage, which is action stage. Okay, so based on these aforementioned persuasive strategies and stages of change, we designed and developed two different versions of the persuasive game, which we called COVID Batman, using COVID-19 as a case study. Both versions target the same end goal, which is creating awareness and promoting the adoption of precautionary measures. However, they target different audience using different persuasive strategies as follows. So version 1 is designed to be appropriate for people at the early stage of behavior change, while version 2 designed to be appropriate for people at the later stage of behavior change. Now, to personalize the game more, each version uses persuasive strategies that are most suitable for the target audience. Based on previous studies, which have shown that people in the early stages of change are influenced by persuasive strategies that promote education and that increase awareness of current behavior pattern. So we use the suggestion strategy for these people. Research also found that these people in the early stage can also be motivated by gamified rewards for following the desired behavior, because they need something to motivate them to start and continue doing actions. So we use the reward strategy. On the other hand, users in the later stage are influenced by persuasive strategies that present visual feedback of their current behavior and the means of compare that behavior. So we employ the competition and the self-monitoring strategies. So as you see here, the personalization is static. Whenever I have a user in the early stage, I use reward and strategy and suggestion strategy. On the other hand, if I have a user in the later stage, I use with that user two other strategies which are self-monitoring and comparison competition strategies. This figure shows snapshots of the game. So the main objective of the game is to teach players and motivate them to keep the COVID-19 precautionary measures, such as avoiding getting close to the COVID-19 virus and other humans like avatars who are potentially infected, by making sure that player's avatar maintains social distance from them, while the player goes about carrying the game task of picking coins. So the player needs to collect these coins while avoiding these infected avatars and keep social distances with these avatars. At the same time, to complete a level and progress to the next level, the player has to move around in every corner of the maze to collect coins and the power-ups. So power-ups are COVID-19 safety and precautionary measures like hand sanitizers or masks. As we see here in this figure, we have hand sanitizer that can be collected by the user. So in addition to collecting coins, the player should maintain the distance from the virus and other infected humans. This creates an engaging experience as the player has to constantly protect their avatar from catching the infection while carrying out the game task of picking coins. So this figure shows how we implemented rewards and suggestion strategies in version 1. So here we have some suggestions provided to the player And the reward strategy is implemented as points added to the user whenever the user stays away of infected people, and whenever it collects more coins from the maze. On the other hand, in version 2, which targeted later stage users, we use self-monitoring and competition strategies. Self-monitoring is implemented as progress bar, which represent player health. So whenever the player gets closer to any infected other person, the health will be decreased. Otherwise, whenever the player collects coins and power-ups, the player health will be increased. And we have the leaderboard, which represent the competition strategy. It shows the order of the top player of the game, which makes some kind of competition and comparison to the user. Now, to evaluate the game, we conducted a quantitative study of 127 users, followed by semi-structured interview of 18 participants. Then we divided the participants into two groups, early stage and later stage of change. And to do that, we used a predefined TTM validated scale to distinguish early and later stage users. And to eliminate the possibility of any bias, we randomly assigned people from each stage to either play their tailored or non-tailored game. So the first group is divided into two groups. Group 1 played version 1, which is tailored to people in the early stage. Group 2 played version 2, which is tailored to people in the later stage. So this is non-tailored to the early stage users. And the same thing was done for the other group of later stage of change users. And to analyze the results, we used quantitative data and qualitative analysis. We used IBM SPSS. The results of conducting ANOVA on the quantitative data and the thematic analysis of the qualitative study show that tailoring the persuasive games to individual stage of change by using appropriate persuasive strategies increased the game effectiveness with respect to its ability to motivate people adopt the precautionary measures toward disease prevention. Here, these figures shows the results of comparing the tailored versus non-tailored versions, and the post hoc test revealed that the tailored version of the persuasive game were more effective than non-tailored versions overall, as shown in this figure. So this shows the mean for the tailored game with the early stage users compared to the non-tailored game for the early stage users, and the same thing for later stage users. The other figure to the right hand side shows the motivational appeal of the game across the four groups for the motivation dimensions, which are attention, relevance, confidence, and satisfaction. And overall, we can notice that tailored games for both groups performing better than non-tailored games. This is one of the examples of static personalization. Now, static personalization is easy to implement, doesn't need high computational power to be implemented. But the problem is that, as we mentioned at the beginning, users' behaviors and users' moods change from time to time. So what works for me today may not work for me tomorrow. The solution in this case is to do personalization at runtime. While the user uses the system, we do personalization. This is more fine-grained personalization than static personalization. And in this dynamic personalization, we personalize at runtime. To do that, we need to use a sort of machine learning and AI-based techniques And these approaches need one important component, which is input or data from the user. This data will be collected interactively while the user uses the system. And based on this data, that system adapted its intervention to the user. As a use case for this dynamic personalization, we have a collaboration with an industry partner who has a product for adults resilience. However, this product provides static and non-personalized solutions and recommendations to users. So the material or the activities that is provided to users are non-personalized at all. So our goal in this project is to develop an adaptive persuasive system called Jack Habit that improves people's resilience. The system will employ various behavior change strategies and adapt them to deliver personalized interventions based on individuals' current emotional state and stage of change. We will use journal logs and emotion data to train machine learning models that is able to understand the mood instantly and therefore be able to provide personalized intervention depending on the mood on time or instantly. So to apply the dynamic personalization in this project, we followed a process of 6 steps as follows. So first we need to collect data and build the backbone of the system. Then after that, we implement the dynamic portion of the personalization process. So first, we selected the most common and least commonly employed persuasive and behavior change strategies. Then we designed prototypes that operationalize these strategies. Second, we evaluated these prototypes with target audience to understand the perceived persuasiveness of each strategy and to map these strategies with users' emotions and other characteristics. Then we analyzed the data collected in step 2, and we mapped emotional states to persuasive strategies based on step 2. So for each emotion state, we say that persuasive strategy X is more suitable when the user is in mode Y, for example, and so on. So we come up with a mapping between users' emotions and persuasive strategies. So this step serves as the backbone of the dynamic personalization, where the inferred mapping will be used as a reference for the personalization algorithm. In the fourth step, we train and compare machine learning classifiers using the data collected in the previous steps, and we select the best performing machine learning model to detect emotions instantly. After that, we build user model for each user. The user model will contain the user's current emotional states and current state of change. In this step, the system predicts on-time users' emotions using the best performing machine learning classifier. So this is the key difference between static and dynamic personalization. Instead of using predefined user models or profiles, we build the model interactively and on time at runtime. Then the system used the emotion strategy mapping developed previously to recommend the most suitable activity or task to user. So again, we build the backbone of this system, and in the runtime, we build user profile and match this user profile to the lookup, let's say, rules that we have in the system. Finally, based on this longer process, we will develop the personalized and adapted Jack Habit product to enhance resilience in adults. So this project is still in progress. Currently, we are conducting a large study to understand users' interactions with the system and users' preferences in terms of persuasive strategies. And this will be a fully dynamic, personalized system. Finally, we have the hybrid personalization, which combines static and dynamic personalization. But the question is, why do we need hybrid personalization? We already have static and we have hybrid. Whenever static is not working very well, we can use dynamic. Well, we mentioned that static personalization does not handle on-time adaptive preference from users. On the other hand, dynamic personalization require input and data, such as emotion from the user or the environment, to do the on-time adaptation. The problem is that data may not be available because users do not usually want to provide information. Another issue with dynamic personalization is that some parties do not have the required equipment to acquire on-time data. Therefore, hybrid personalization becomes a good middleware solution between these two solutions. Currently, we are working with another industrial business partner called Feeling Moody to develop an AI-driven mental health platform to enhance therapeutic process. This app has 3 main features, and it's currently available for iOS store, Apple Store. The main features are mood track, where users enter their moods in regular basis, journaling, where users can enter journal entries, free text entries, and mind fitness, which is the recommendation part of the system, where the system provides some exercises to the users to enhance their mental health. Now, the industrial partner aimed to have a fully AI-driven mental health platform that uses dynamic personalization based on moods, which will be detected from the journaling entries. However, based on our analysis of the available data, we noticed that a high percentage of the users do not enter journaling entries in a regular basis. So we opt for a hybrid solution where the system implements dynamic personalization when possible and use general rules based on static personalization otherwise. To achieve our goal, this project is divided into 2 phases. In phase 1, we did the static personalization. We collected data. The data contains in the wild interaction between 434 users and the system from January 2020 until December 2021. And we studied the user's perception of features. Then we mapped users' moods to different activities, such as work-based activities, home-related activities, friend-related activities, school activities, and so on. And we drew a general personalization rules at the end. In the second phase, which is now postponed until we have enough data to train the machine learning model. In this phase, we will do the dynamic personalization based on machine learning models that provide adaptive recommendations based on user moods. So here's an example of the results that we have collected. So this figure shows the distribution of factors by season, and it shows how users' interactions and how factors that affect users' moods different from one season to another. So these bars, everyone shows one of type of activities. So this bar shows home-related activities, which means that the users reported that their moods was based on home-related activity, or their mood was based on work-related activity that they have done. And based on these results that we have, we could infer some static rules for personalizing systems, as we see here in these examples. So we said that based on season, the system can be personalized as follows. During the summer, mental health apps should emphasize family and friend-related activities. So if I have a user with a bad mood, the system can suggest some activities that are related to family and friends and can enhance user mental health based on that. Also, we noticed that, or we inferred that school-related activities should be less emphasized in the summer. Then, furthermore, our results show that there are differences in the association between mood and activities for the time of the day and months. So this figure shows the difference in time of a day between AM and PM. We observe that work-related activities can be the reason for mad mood, well, can be the most common reason for mad mood. So based on these results, we inferred some rules, such as this one. An app may consider implementing the reminder strategy in an adaptive way, such that more reminders are sent to users in the AM than PM. Because when the user is in a bad mood, they may not use the system, or they may not accept suggestions and reminders when they are in bad moods. Now, as mentioned, this is the first phase of this project. The next one is to do the dynamic personalization of the same project. Now, to summarize, we said that persuasive technologies have shown success in health and wellness. Hundreds of applications have been developed, and they are used by millions of users now, both in all mobile service providers. The one-size-fits-all approach no longer fits all. We need personalization, because personalization increases persuasive technologies' performance. And finally, we have three main categories of personalization approaches, which are static, dynamic, and hybrid approaches. These are some of the references I have used in the presentation. Any questions, please? Thank you again for having me. I wish that you have enjoyed the presentation. Please let me know if you have any questions.
Great, thank you, Alaa. This was very interesting, a change of pace, as I mentioned before. I have some questions, and other people may want to raise their hand or write in the chat. My first question is so from where we work in my lab, I'm aware of mHealth apps that use, for example, like models, like let's say a pharmacokinetic model of like how drug concentrations change in the body to personalize drug taking, for example, in ADHD. So, you know, you have a child who's at school and you want to make sure that they have sufficient amounts of doses of their ADHD drug over the day, but you take into account their activities. And I wondered if you guys have ever thought of, or if you know of examples of trying to merge something like that, where you have like a predictive model that tells you when the best time to take a drug or do an activity might be, and a kind of dynamic or even a static persuasive game type model that helps, say, a child know, like, to be motivated to take their drug.
I know that there are many research projects in this domain, but I don't have exact name or title of some of these research or some of these applications that are used. Static personalization is domain dependent. We can't say that you can use the results that I have just presented in mental health and apply them for other domain as is. We have to study every domain as a separate domain, as a different context. We have to study the target audience. When we are talking about child, they have different requirements than adults or than older people. So all these factors, which are contextual factors, make big difference. Back to your questions, I'm not aware of research that did what you are asking about, but there could be some research on that.
Mm-hmm. And when you were talking about the COVID game, you mentioned the TTM. I wrote down the acronym, but I, of course, now forget what it is, but it's basically the hierarchical model of motivation, I guess, in some sense.
The trans-theoretical model.
And I guess in the context that we're in now, for example, where we're taking off public health measures, do you know with respect to that, that model, if somebody was previously active, for example, they were actively using masks or they were actively using public or social distancing measures,
Yes.
and then they stop, how hard is it to get them back on that train, which I think is something that we're all going to be asking ourselves at some point.
I think this will be more difficult to get them back than one who has started in the early stage of change, because most likely they switched based on beliefs. It's very hard.
Yeah.
Yeah, but this is a good question that should be considered in the research. Yeah.
Interesting. And so whatever came of the COVID Pac-Man game, was it just for research to understand, or was it for developing something?
We already developed the game. The game is there, but I think it's not available for public. But we have the actual game, and for research side, it's already published. The paper is published in one of the premier venues in the HCI journal. Yes, but the project is there, the game itself.
Okay, great. Are there any other questions from anyone? Okay, well, I just want to thank you again for a really thought-provoking talk. Like I was mentioning, I know of these kinds of persuasive, I don't know if they're games, but they're, like mHealth apps to promote drug, like not drug taking, like not illicit drugs, but like pharmaceutical drug taking for people who might have problems following prescriptions or things like that. And they've actually been shown to be useful. Those ones were more, they had more active intervention. I think it was people who people could also connect with real people to call them as reminders. But I'm sure that this kind of hybrid approach where, some people need active reminders and some people can manage with prompts is probably relevant there.
Yes, and by the way, these games are called serious games. Mm-hmm. When the person play for a purpose. It's not just for fun reasons.
Right.
Yeah, they're called serious games, and they have shown very successful results in changing behaviors.
Right. Yeah, exactly. And I think that, like I was mentioning, these are for people who are at high risk of either I believe it was a PrEP study where they were trying to prompt people to take antiretroviral drugs to prevent infections in high risk populations. And I think, like you said, it was quite successful, and from what I remember, but it was a few years ago. Great. Okay. Well, thank you so much. And I hope you have a great rest of your day. And we really appreciate your talk. And it was nice.
My pleasure.
Great. Thanks so much.
Thank you so much for having me.